Question 1. A client taking fluoxetine, Prozac, reports restlessness, confusion, and tremors. The nurse suspects A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Extrapyramidal reaction. D. Akathisia. Answer, A. Rationale: serotonin syndrome occurs due to excess serotonin, causing confusion, agitation, tremor, diaphoresis, and hyperreflexia. Question 2. Which teaching should the nurse provide for a client starting phenelzyme, Nardil? A. Avoid aged cheese and red wine. B. Increase intake of fermented foods. C. Take with an SSRI for better effect. D. Stop medication immediately if headache occurs. Answer, A. Rationale: MAOIs like phenelzyme require a tyramine-restricted diet to prevent hypertensive crisis. Question 3. A nurse monitors a client taking haloperidol, Haldol, for schizophrenia. Which finding requires immediate action? A. Mild tremor. B. Shuffling gait. C. High fever and muscle rigidity. D. Dry mouth. Answer, C. Rationale: these are signs of neuroleptic malignant syndrome, NMS, a medical emergency. Question 4. The nurse teaches a client on lithium carbonate about fluid intake. Which statement indicates understanding? A. I will avoid salty foods. B. I will maintain consistent salt and fluid intake. C. I will double my fluid intake. D. I will reduce sodium when sweating. Answer, B. Rationale: sudden changes in sodium intake can cause lithium toxicity or ineffectiveness. Maintain consistency. Question 5. Which symptom is an early sign of lithium toxicity? A. Polyuria. B. Hand tremor and nausea. C. Blurred vision. D. Seizure. Answer, B. Rationale: early signs include GI upset, tremors, and mild ataxia. Severe toxicity causes confusion and seizures. Question 6. A client taking clozapine, Clozaril, reports a sore throat and fever. What should the nurse do first? A. Encourage fluids. B. Withhold medication and notify provider. C. Administer acetaminophen. D. Continue therapy as prescribed. Answer, B. Rationale: signs suggest agranulocytosis, a serious adverse effect of clozapine. Obtain WBC count. Question 7. The nurse is preparing to give lorazepam, Ativan, to a client with anxiety. What is the major safety concern? A. Bradycardia. B. Respiratory depression. C. Hyperactivity. D. Hypertension. Answer, B. Rationale: benzodiazepines depress the CNS and can cause respiratory depression, especially with alcohol. Question 8. A client on amitriptyline, Elavil, reports dry mouth, blurred vision, and constipation. The nurse recognizes these as A. Allergic reactions. B. Anticholinergic side effects. C. Serotonin syndrome. D. EPS symptoms. Answer, B. Rationale: TCAs cause anticholinergic effects, dry mouth, urinary retention, constipation, and blurred vision. Question 9. The nurse teaches a client about buspirone, Buspir. Which statement shows correct understanding? A. It may take several weeks to feel better. B. It causes sedation like other anti-anxiety drugs. C. I will take it with alcohol. D. I can stop it suddenly. Answer, A. Rationale: buspirone has no abuse potential but takes 2 to 4 weeks for full therapeutic effect. Question 10. The nurse is teaching a client about sertraline, Zoloft. Which teaching is most important? A. Avoid direct sunlight. B. Report any thoughts of suicide. C. Take with milk. D. Stop if insomnia occurs. Answer, B. Rationale: all antidepressants carry risk of suicidal ideation, especially in the initial weeks. Question 11. Which laboratory test should be monitored regularly for a client taking valproic acid, Depakote? A. BUN and creatinine. B. Liver function tests. C. Thyroid panel. D. Serum potassium. Answer, B. Rationale: valproic acid can cause hepatotoxicity. Monitor AST, ALT, and bilirubin levels. Question 12. A nurse is caring for a client taking chlorpromazine, Thorazine. The client develops a stiff neck and eyes rolling upward. What should the nurse do first? A. Reassure the client it will pass. B. Administer benztropine, cogentin. C. Hold the next dose. D. Notify the physician only. Answer, B. Rationale: acute dystonia, an extrapyramidal symptom, EPS, is treated with anticholinergic drugs like benztropine. Question 13. A client taking risperidone, Risperdal, reports weight gain and increased appetite. The nurse explains this is A. A temporary allergic reaction. B. A common side effect. C. A sign of toxicity. D. An indication of diabetes. Answer, B. Rationale: atypical antipsychotics often cause metabolic effects such as weight gain, dyslipidemia, and insulin resistance. Question 14. Before administering lithium, which lab result should prompt the nurse to hold the medication? A. Sodium 140 milliequivalent/L. B. BUN 25 mg per deciliter. C. Lithium level 1.4 milliequivalent/L. D. Lithium level 0.8 milliequivalent/L. Answer, C. Rationale: therapeutic lithium range is 0.6 to 1.2 milliequivalent/L. Levels above 1.2 indicate toxicity risk. Question 15. A nurse observes tardive dyskinesia in a client taking long-term haloperidol. Which finding supports this? A. Tremor in hands. B. Lip smacking and tongue protrusion. C. Muscle rigidity. D. Drooling. Answer, B. Rationale: tardive dyskinesia presents with involuntary facial movements, often irreversible. Question 16. A client on venlafaxine, Effexor, suddenly stops the medication. What is the nurse's priority? A. Assess for withdrawal symptoms. B. Encourage fluid intake. C. Monitor for hypotension. D. Start an SSRI immediately. Answer, A. Rationale: abrupt withdrawal from SNRIs can cause dizziness, agitation, and sensory disturbances. Question 17. Which symptom indicates neuroleptic malignant syndrome in a client taking antipsychotics? A. Sweating and diarrhea. B. Sudden high fever and muscle rigidity. C. Hallucinations. D. Hypotension. Answer, B. Rationale: NMS is a life-threatening reaction to antipsychotics characterized by fever, rigidity, and altered consciousness. Question 18. The nurse instructs a client taking paroxetine, Paxil. Which statement shows understanding? A. I might feel sleepy, but it will improve. B. I should stop if I feel better. C. I can take it with an MAOI. D. It works immediately. Answer, A. Rationale: SSRI side effects, fatigue, insomnia, often improve within a few weeks. Medication should not be stopped abruptly. Question 19. A client with bipolar disorder is prescribed carbamazepine, Tegretol. Which instruction is most important? A. Avoid milk products. B. Report any signs of infection. C. Increase vitamin C intake. D. Expect blurred vision. Answer, B. Rationale: carbamazepine may cause agranulocytosis, report fever, sore throat, or mouth ulcers immediately. Question 20. What should the nurse teach a client about benzodiazepine, alprazolam/Xanax, use? A. Stop when you feel better. B. Avoid alcohol and CNS depressants. C. Take it with grapefruit juice. D. It can be safely used long-term. Answer, B. Rationale: combining benzodiazepines with alcohol or opioids increases the risk of respiratory depression. Question 21. Which medication is used to treat acute alcohol withdrawal? A. Disulfiram, Antabuse. B. Lorazepam, Ativan. C. Fluoxetine, Prozac. D. Naltrexone, Revia. Answer, B. Rationale: benzodiazepines, e.g., Ativan, help prevent seizures and delirium tremens in alcohol withdrawal. Question 22. Which drug combination is contraindicated due to serotonin syndrome risk? A. SSRI and MAOI. B. SSRI and benzodiazepine. C. SSRI and beta blocker. D. SSRI and antacid. Answer, A. Rationale: combining serotonergic agents like SSRIs and MAOIs causes serotonin toxicity. Question 23. A nurse teaches a client taking disulfiram antabuse. Which statement indicates understanding? A. If I drink alcohol, I will get very sick. B. I can have cough syrup with alcohol. C. This medicine reduces cravings safely. D. It treats withdrawal symptoms. Answer, A. Rationale: disulfiram causes severe vomiting, flushing, and hypotension when alcohol is consumed. Question 24. Which drug is classified as a mood stabilizer? A. Lithium. B. Fluoxetine. C. Clozapine. D. Buspirone. Answer, A. Rationale: lithium stabilizes mood swings in bipolar disorder. Question 25. A nurse should caution a client taking chlorpromazine about A. Photosensitivity. B. Diarrhea. C. Weight loss. D. Increased alertness. Answer, A. Rationale: phenothiazines cause photosensitivity, clients should avoid direct sunlight and use sunscreen. Question 26. A client taking olanzapine, Zyprexa, is at risk for which adverse effect? A. Weight loss. B. Hypoglycemia. C. Metabolic syndrome. D. Bradycardia. Answer, C. Rationale: atypical antipsychotics like olanzapine increase the risk for diabetes and dyslipidemia. Question 27. Which finding indicates a therapeutic lithium level? A. 0.2 milliequivalent/L. B. 0.8 milliequivalent/L. C. 1.6 milliequivalent/L. D. 2.0 milliequivalent/L. Answer, B. Rationale: therapeutic range is 0.6 to 1.2 milliequivalent/L. Above that, toxicity may occur. Question 28. Which medication is used to treat opioid dependence? A. Methadone. B. Diazepam. C. Disulfiram. D. Lithium. Answer, A. Rationale: methadone prevents withdrawal symptoms in clients recovering from opioid addiction. Question 29. The nurse should monitor a client on clozapine for A. Hypertension. B. Low white blood cell count. C. Weight loss. D. Bradycardia. Answer, B. Rationale: clozapine causes agranulocytosis, increasing infection risk. Question 30. A client taking bupropion, Wellbutrin, should avoid this condition. A. Hypertension. B. Seizure disorder. C. Diabetes. D. Asthma. Answer, B. Rationale: bupropion lowers seizure threshold, contraindicated in seizure disorders. Question 31. A nurse is monitoring a client who recently started sertraline, Zoloft. Which symptom should be reported immediately? A. Drowsiness. B. Insomnia. C. Increased suicidal thoughts. D. Dry mouth. Answer, C. Rationale: all SSRIs can increase suicidal ideation early in therapy, requires urgent evaluation. Question 32. Which statement by a client taking lithium indicates the need for further teaching? A. I will drink 6 to 8 glasses of water daily. B. I will take my lithium with meals. C. I can take ibuprofen for headaches. D. I will report tremors or confusion. Answer, C. Rationale: NSAIDs like ibuprofen increase lithium levels, raising toxicity risk. Question 33. A client taking imipramine, tofranil, experiences dizziness when standing up. The nurse explains this is due to A. Anticholinergic effect. B. Orthostatic hypotension. C. Cardiac toxicity. D. Electrolyte imbalance. Answer, B. Rationale, TCAs cause alpha-adrenergic blockade, leading to orthostatic hypotension. Question 34. A nurse reviews medications for a client on MAOIs. Which over-the-counter drug should be avoided? A. Acetaminophen. B. Pseudoephedrine, Sudafed. C. Ibuprofen. D. Guaifenesin. Answer, B. Rationale, pseudoephedrine and similar drugs cause hypertensive crisis when combined with MAOIs. Question 35. The nurse is teaching a client taking clonazepam, Klonopin. Which instruction is most important? A. Avoid driving until you know how it affects you. B. Take it only on an empty stomach. C. Stop if you feel sleepy. D. You can use alcohol occasionally. Answer, A. Rationale, benzodiazepines cause drowsiness and impaired coordination, avoid driving or machinery. Question 36. A client on fluoxetine develops fever, muscle rigidity, and confusion. The nurse suspects: A. Serotonin syndrome. B. Withdrawal reaction. C. Hypoglycemia. D. Neuroleptic malignant syndrome. Answer, A. Rationale, fluoxetine, SSRI, can cause serotonin syndrome, especially when combined with MAOIs or St. John's wort. Question 37. Which statement by a client on lithium needs correction? A. I will eat a balanced diet with normal salt. B. I'll skip my dose if I have diarrhea. C. I will increase fluid intake in hot weather. D. I can take it with food to reduce nausea. Answer, B. Rationale, skipping doses may lead to instability. Instead, report dehydration or illness that can cause toxicity. Question 38. A nurse is preparing discharge teaching for a client on haloperidol. Which instruction is most appropriate? A. Avoid prolonged sun exposure. B. Stop the drug if tremors occur. C. You can drink alcohol in moderation. D. Take medication only when needed. Answer, A. Rationale, phenothiazine antipsychotics increase photosensitivity. Clients should wear sunscreen and protective clothing. Question 39. The nurse suspects akathisia in a client on antipsychotic therapy when the client: A. Has a shuffling gait. B. Constantly moves and cannot sit still. C. Experiences involuntary tongue movements. D. Complains of muscle rigidity. Answer, B. Rationale, akathisia is an EPS characterized by restlessness and inner agitation. Question 40. Which nursing intervention is priority for a client taking clozapine, Clozaril? A. Monitor blood glucose weekly. B. Check WBC count regularly. C. Encourage low-sodium diet. D. Increase dietary fiber. Answer, B. Rationale, agranulocytosis is a life-threatening side effect of clozapine. Monitor WBC count weekly. Question 41. A nurse should hold lithium if the client presents with: A. Thirst and mild tremor. B. Diarrhea, ataxia, and vomiting. C. Increased urine output. D. Mild headache. Answer, B. Rationale, GI distress, ataxia, and vomiting indicate lithium toxicity. Hold dose and notify the provider. Question 42. Which drug may be prescribed for EPS in a client taking antipsychotics? A. Benztropine, Cogentin. B. Fluoxetine, Prozac. C. Buspirone, Buspir. D. Disulfiram, Antabuse. Answer, A. Rationale, benztropine, an anticholinergic, treats extrapyramidal side effects. Question 43. The nurse identifies a potential interaction when a client taking St. John's wort is prescribed: A. Haloperidol. B. Fluoxetine. C. Lithium. D. Buspirone. Answer, B. Rationale, St. John's wort plus SSRI increases risk of serotonin syndrome. Question 44. Which antipsychotic has the lowest risk of extrapyramidal symptoms? A. Haloperidol. B. Risperidone. C. Clozapine. D. Flufenazine. Answer, C. Rationale: clozapine, an atypical antipsychotic, rarely causes EPS but has agranulocytosis risk. Question 45. A nurse teaches a client on diazepam, Valium. Which instruction is correct? A. Do not stop suddenly after long use. B. Take it with alcohol for stronger effect. C. Drive if you feel alert. D. It will cure anxiety permanently. Answer, A. Rationale: abrupt discontinuation can cause withdrawal seizures and rebound anxiety. Question 46. Which antidepressant is most likely to cause sexual dysfunction? A. Bupropion. B. Sertraline. C. Trazodone. D. Mirtazapine. Answer, B. Rationale: SSRIs, like sertraline, frequently cause decreased libido and delayed orgasm. Question 47. A client taking MAOIs reports a severe headache. What is the priority action? A. Offer fluids. B. Administer antihypertensive as ordered. C. Apply cold compress. D. Give acetaminophen. Answer, B. Rationale: headache may signal hypertensive crisis from tyramine intake, treat with 4 antihypertensives. Question 48. Which finding indicates effective therapy with clozapine? A. Decrease in hallucinations. B. Increased WBC count. C. Sedation. D. Weight loss. Answer, A. Rationale: clozapine reduces hallucinations and delusions in schizophrenia. Question 49. A nurse should instruct a client taking trazodone for insomnia to: A. Take with alcohol for faster sleep. B. Change position slowly. C. Take it in the morning. D. Stop if drowsiness occurs. Answer, B. Rationale: trazodone can cause orthostatic hypotension, changing position slowly prevents dizziness. Question 50. Which statement by a client on bupropion, Wellbutrin, indicates understanding? A. It may decrease my sexual side effects. B. It causes weight gain. C. It will make me sleepy. D. I'll take it right before bedtime. Answer, A. Rationale: bupropion is unique among antidepressants, it reduces sexual side effects and may cause mild stimulation. And that's a wrap, champs. You just reviewed 50 high-yield NCLEX Psych Med questions in under 45 minutes. Remember, consistency builds confidence, and confidence passes the NCLEX. If this helped you, tap like, drop a comment, and subscribe to NCLE's Medizi 91 for more daily power reviews. Until next time, keep studying smart, keep believing, and keep moving toward that RN dream.